everybody. Again, my name is Jared Agonian. I serve as the San Fernando Valley Field Deputy for LA County Supervisor Mike Antonovich. I want to thank the Neighborhood Council for changing their agenda and allowing all of us here to be here tonight to address the community. Thank all of you for taking your time to be here tonight to hear the gas company and the different government regulators and agencies here to give this presentation and to fill you in a little bit on the respective jurisdictions that you have here tonight. So the first thing I'm going to keep my comments extremely brief and turn it over to the various agencies that are here represented. But the one thing I wanted to impart to you on behalf of the supervisor is to show that the overwhelming presence of the government agencies that are here from the city, county, and state level. We have a lot of representatives if you look around the room, not just up here on this panel, but we're scattered throughout the room to address your questions both publicly and privately. In addition, your local elected officials and state elected officials, we've been speaking to each other as well. I want to ensure to you that all four at the elected level that we are talking to each other. I want to say that Dusty Russell from Senator Frank Pavley's office is here. Andre Hollings from Assemblymember Scott Wilk's office is here. Megan Cottier from Councilmember Mitch Englander's office, and as well from Supervisor Antonovich's office, Elizabeth Singer. The reason why I mentioned their names is again to show you the amount of communication and coordination taking place between the various government agencies. Specifically at the county level, what I've asked them to do today on behalf of the county and what the supervisors asked them to present on is very brief description of the jurisdiction, what their jurisdiction is in regards to the situation, what responsibilities they have, both currently and possibly into the future. And just to give a very small discussion, we want to save more time for some of your questions that you might have. And at the county level, we have the Los Angeles County Fire Department, Hazardous Materials Division, Los Angeles County Public Health, and South Coast Air Quality Management District. And at this time, I'm going to turn it over to LA County Fire.
Thank you very much, and again, I want to say thanks for allowing us to come to your meeting and hopefully give the folks in the room information in terms of what we know and what's going on up at the site. My name is Bill Jones. I'm Chief of the Health Hazmat Division in the Los Angeles County Fire Department, and we are a regulatory agency, but we also have an emergency response component. In the regulatory programs that we are involved with, we regulate businesses and facilities that handle hazardous materials and generate hazardous waste. We have underground tanks or above ground tanks and other things that occur in other facilities. So we visit this site for inspections. We ensure that they're in compliance with state and local laws and regulations related to the various programs that I just mentioned. We also have a very robust emergency operations section. We have teams on call 24/7. We don't roll out of stations. We roll out of private homes and from our offices, but we do come out 24/7. So from that perspective, we're here to ensure public health and the environment is protected, and we are sort of the experts from the chemistry standpoint of the incidents that we are involved with. The incidents could be everything from abandoned drums to freeway incidents involving fuels to fires at commercial facilities, refineries, whatever the case might be. Our role in those types of incidents is to investigate what's going on, find out what the cause is. You know, in some cases, make determinations on what type of materials we're dealing with. A lot of times we have unknown type of situations. In this case, it's very well known what we're dealing with. Once we find out that kind of information, we make a determination in terms of the immediate needs. Is there an immediate need to evacuate or immediate need to take immediate action, so to speak? So we make those kind of calls when we respond to these incidents. In this particular case, that was one of the first things that we did. Is there a need for immediate action because there's an imminent situation occurring? And in our assessment, when we rolled out initially, we made a determination that that wasn't the case. We didn't have explosive levels of the gas that would be of concern in the neighborhoods. We had teams out here monitoring with our monitoring equipment as well as our nose, because that odorant that's in gas is detectable at very low levels with our own noses. So once that was done, we immediately started making notifications and contacting a number of different agencies to make sure all the necessary players were in the game, including our partners with LA City Fire that have a fire station down the street. We wanted to make sure that they were aware of what was going on and weren't just responding to medical calls or complaints without knowing the big picture of what was happening up on the hill. So in the first day that we responded, we in fact made numerous calls to LA City Fire, including LA County Fire also, because we wanted to make sure that our hazmat squads were aware of the situation here, not only in the neighborhoods, but what if something happens up on site while they were trying to mitigate or fix the problem. So we notified our hazmat squads. We started making contact with all the different regulatory agencies and agencies that might have a play here to find out what they knew, to find out what activities they were engaged in, to find out what kind of sampling was being done, what kind of results were being obtained in that activity. So once that was done, we continued to monitor and we continued to oversee. What you see here today and tonight is a number of different response and regulatory agencies that have particular interest in the various activities that are going on at the site. From our perspective, LA County Fire Health Hazmat, we're there to make sure that public health and safety is protected and the environment is not impacted, and that everything that occurs from the time we're notified through the resolution of the entire incident is done properly with safety in mind. So the other thing that I wanted to mention is that we continue to monitor the situation with our partners in the other agencies. This is a joint effort. This is many agencies that have been brought together on this effort to make sure that everybody's concern is met. Everybody from Dogger to the fire department to AQMD to public health. Public health plays a real key role in community health, and they're here to talk about that, so I won't get into that part of it. But in a nutshell, we will be here and we will continue to be involved until this thing is resolved. We will continue to make sure that the appropriate people that have an interest in this are informed. And also to answer your questions, if you have any questions, we are here as part of the whole group to answer any questions that you might have. Thank you very much.
Next, I'd like to turn it over to the South Coast Air Quality Management District.
I don't know if this cord is quite long enough, so I'm going to have to scoot back. Well, good evening, everybody. My name is Ed Pupgut, and I am a Senior Enforcement Manager with the South Coast Air Quality Management District. Thank you for having us here tonight. Appreciate the opportunity to come and speak with you. We are a 4-county regional government agency. We have jurisdictional oversight over Los Angeles, Riverside, Orange, and San Bernardino counties. In regards to this particular instance, but more specifically what we do as an agency, we regulate stationary sources of air pollution. And so the kinds of sources that we look at and regulate are things like service stations, dry cleaners, manufacturing, commercial operations, actually all the way up to refineries and power plants. We also regulate oil field production and gas production facilities as we have here in this area. How do we go about doing that? Well, we have a cadre of inspectors who go out into the field. They regularly visit different businesses, inspect for compliance with our rules and regulations. We also issue permits with conditions on them. And as a part of that process, they evaluate compliance with those rules and regulations. Our role and capacity in regards to this particular incident, I see as I walked in here that you folks actually have our complaint number posted here. It's 1-800-CUT-SMOG. So in addition to our involvement in terms of interfacing with all of the agencies here at the table, we have also been responding to air quality complaints out here. Our involvement with this incident actually occurred the day after apparently the incident began back on Friday, I believe it was the 24th. We began getting complaints on around Saturday the 25th. And from that time forward, my agency has been out here daily and into the late night responding to your complaints from the community. As of just a short while ago, we have received in total of about 180 complaints, and the complaints have been coming into our agency either through our 1-800-CUT-SMOG line, or they have been coming through over the internet. We also have a web-based page where you can actually report your complaints there. In response to those complaints, what is it that we do? I mean, first and foremost, as with the other agencies here, our concern is also air quality and public health. In this regards, our inspectors have been responding to the complaints. They have been at the facility in an effort to first try to understand just exactly what the cause of the problem is. And you need to understand this is an ongoing development process. We, as the other agencies here, and as SoCalGas is, we are learning more and more on a daily basis just about what's causing this situation, and in particular what the steps are to remedy it. We also have been, where we can, meeting with the complainants as the complaints are coming through. While we do have an emergency response component to our agency, in this instance we have staff that have been staged out in the area here and have been effectively trying to timely respond to your complaints. Part of our process is, in addition to checking out the facility, we would also want to spend time with you as a complainant, to interview you, to get an understanding about the nature of the complaint, how you're describing the odors, the intensity of the odors. Our effort is also try to identify a source. And then also critically in this is to try to also confirm the odors with the complainants. So our inspectors, we are experts at what we do, but part of that is also interviewing you, but also attempting to confirm with you the odors at your residence or your place of business, or in some instances the schools that have reported. We have been in discussions on a daily basis with the gas company. We have been interfacing regularly with the other agencies here that are at the table today, and with the sole function and purpose of really trying to seek a solution, but more importantly, remedy the issue with the releases that are causing the odors in your community. The other component that what we do here is, in addition to the other sampling that the other agencies do, and SoCalGas has done, my inspectors are also equipped in the field with sampling devices. We have, in a couple of instances, been able to collect samples in the community when we've been with the residents and actually have detected and confirmed the odors with the complainants. We also serve in a support capacity at the other agencies if in fact they need chemical analysis done by our lab. And then we provide and share that information back to the other agencies to discuss further issues about potential health impacts. Our role in this instance has also been in a support capacity to the other agencies here. So, what I would ask you to do, I would encourage you to continue to report your air quality concerns to my agency. It's a way for us to document the extent of the odors that are impacting the community, our ability to share that in terms of how the odors are being dispersed, and then again, working with the other agencies of SoCalGas to remedy the problem. I encourage you to ask questions, and certainly we'll all be available afterwards. So, thank you very much for having us. It's been a pleasure to be here tonight. Thank you.
Lastly, on behalf of the county, I know a lot of your questions may be in regards to health and impacts of health, and I want to introduce the LA County Public Health Department.
Good evening, everyone. My name is Katie Butler. I'm an epidemiologist with LA County Department of Public Health. Specifically, I'm in the Toxics Epidemiology Program, and we focus on assessing the toxicity of environmental exposures. And we're here tonight to make sure that the appropriate actions are being taken to protect public health. The director of my program, Dr. Cyrus Rangan, and myself, we had the opportunity to review the air sampling results that were mentioned earlier. There's air sampling results from both the Southern California Gas Company and from AQMD. And what we do is we review the results with respect to short-term and long-term health effects. We rely on the fire department for the assessment of the acute health effects, like was mentioned, like you've heard earlier. So we focus our efforts on assessing those short-term and long-term effects. And with respect to the long-term effects, the levels of chemicals that were reported in the air sampling results are much lower than anything that we would be concerned about. And when you look at those, if you go online and look at those results, you'll see results for mercaptan, the odorant that was mentioned earlier, and that's the chemical that a lot of you are smelling in the air. And while we don't believe that anyone should have to smell that odor, because your quality of life is very important to us, to provide some perspective, the long-term health effects would occur at 1,000 to 10,000 times higher than that odor threshold. So the odor that you're smelling is because of the low threshold of mercaptan. And also when you look at those air sampling results online and what we looked at, you'll also see results for other gases that are often found in natural gas, called benzene, toluene, ethylxylene. This is a group of gases commonly referred to as BTEX. Those chemicals were also found below levels that would cause concern for long-term health effects. As far as the short-term effects of the odor, we have been receiving calls that some of you are experiencing headaches and nausea because of the odors, and it's important to us that this gas leak get resolved quickly because, like I said, we don't believe you should be having to smell these odors because it can impact your quality of life. And I'm happy to answer any other questions about the chemical effects or odor-related effects of the natural gas components. Thank you.
That will do it on behalf of the county representatives. Paul, I'll turn it over to you or to any other agency that wants to speak.